Hi everyone, welcome to researchmd.com. We are going to talk about the #1 selling drug in the world today, which is Viagra or Sildenafil. My name is Pramil Cheriyath. I'm a program director, internal medicine residency, transitional residency. I teach medical students and residents. I'm also director of research. So let's get in. If you look at erectile dysfunction, it's one of the biggest medical problems all over the world. As we get older, erectile dysfunction increases like tremendously, even younger people. Okay, studies have shown like staggering facts. Like if studies have shown over 18 million people in the United States, okay, have erectile dysfunction. 18.4% of the male population aged 20 years or older. Very scary. Age 20 years of older. 18 to 20% can have erectile dysfunction. So what is, how does it work, like the mechanism of like an erection? We're going to start with the erection first, okay? First you have the arousal, there's parasympathetic signal to the penis, nitric oxide release, guanylyl cyclase, and GTP is converted into CGMP. That's the main pathway. That CGMP causes like smooth muscle relaxation and you have an erection. Remember, three things we have to know. We have to know about the nitric oxide production, GTP converted into CGP, smooth muscle relaxation, then you have the erection. Okay, then how does Viagra works? Viagra works on inhibiting the CGMP is broken down to 5-GMP, and the Viagra or phosphatidylsterase inhibitor class of drugs block that. Okay, so one thing also you have to know about the nitric oxide production. Any drug which can increase the nitric oxide production can potentiate or increase the effect of Viagra and cause problems. So Viagra is also, the name is Sildenafil. It's a blue film-coated, rounded, diamond-shaped tablet. It equivalent to 25 milligram or 100 milligram, and used for the treatment of erectile dysfunction. The dose, you start with the lowest dose, like 25 milligram, 50 milligram, and 100 milligram. Maximum is supposed to take only once per day. Okay, when should we take it? Viagra should be taken, the recommendation, you should take 1 hour before the sexual activity, or anywhere if you take it before like 30 minutes to 4 hours before the sexual activity. Okay, anywhere between 30 minutes to 4 hours before sexual activity. Can I take with alcohol? No, taking with alcohol is not recommended. It can cause a lot of problems, okay? And use with the food, Viagra, you can take with the food or without food. Does not make any difference. But if you take with a fatty meal, it's not recommended. It can cause problems. So Viagra cannot be taken with a fatty meal, okay? Now, what are the absolute contraindications to take Viagra? #1, nitrate. Remember, nitric oxide production. So it can potentiate the hypotensive effect of nitrates, and you could actually die. So be careful, check with your doctor to make sure you're not taking any nitrate drugs. So it is an absolute disaster, and you're going to die if you take nitrates, okay? Hypersensitivity reaction, like any drug, if you're allergic to the drug, it can cause rash and urticaria. So what happens if you have like renal failure? First thing you have to always calculate the creatinine clearance, okay? No dosage adjustment if it's mild. Let's say creatinine clearance is like 50 to 80, no dosage adjustment is needed. If it is moderate, 30 to 40, you don't need any renal impairment. In severe renal impairment, we call when the creatinine clearance 30 ml per minute, you need to be careful about you start with a low dose, like 25 milligram, okay? So severe renal impairment with the creatinine clearance less than 30 ml per minute, the sildenafil clearances will decrease. So you can have higher plasma concentration. So be careful. So if it is severe renal impairment, start with a dose of 25 milligram. Hepatic impairment, first thing you have to do, look at the liver. What class, does he have liver failure? There's a child who class A, class B classification. If it is A and B, this clearance going to be decreased. You start with a low dose of 25 milligram. And if it is severely impairment, there's a child who class C, please do not take it. It's contraindicated, okay? Drug interactions, again, if you're on ritonavir, HIV drug, you cannot take it. Alpha blockers can potentiate the effect, don't take it. CYP3/4 inhibitors, there's like a lot of class of drugs with the CYP4 inhibitors, even Marijuana can cause this, involved in the CYP3 metabolism. Be careful about it, okay? So side effects, the headache, flushing, dyspepsia, nasal congestion. Most common is like the headache, flushing, and dyspepsia, okay? Now, let's look at some of the questions people have. Did people die from taking Viagra? Of course. There's 30 deaths occurred among 2 million users initially. So most of the people were taking Viagra and nitrate, which is an absolute contraindication. But the people who died, if they have like heart disease, hypertension, diabetes, and chronic disease. So can I take Viagra if I have a heart disease? Be careful. Check with the cardiologist first. Get a cardiac evaluation, get an exercise treadmill test, look at your exercise capacity, and then based on the cardiologist's recommendation, you should proceed. Now, can I take Viagra with the poppers? No. You could, because they are amyl nitrate containing, which is like organic nitrate. We already talked about it can cause vasodilatation, so it will interact. You could die. So don't take Viagra with the poppers. Can I take Viagra with marijuana? No. It can potentiate the vasodilator effect of Viagra. You can have cardiovascular death. Can I take Viagra with cocaine? No. Again, cardiovascular problem, heart attack, aortic dissection, permanent. If you have like cardiac history, there's also a big chance you could die from heart attack. Even if you don't have cardiac history, it can cause like heart attack. So you should not take Viagra with cocaine, okay? You can also cause like this deadly serotonin syndrome and die. What happens if I overdose? Some people reports of like if you overdose, prolonged priapism, right? 5 days, 6 days. What's going to happen? You can have necrosis, gangrene of the penis. There's an incident in Colombia, man. They have to amputate the penis. So be careful. It can cause like hypotension, tachycardia, and cardiac arrest. So be careful with the dose. Overdose, you could also die. Thank you so much for watching. We'll be back with another presentation. Please subscribe to our channel. Thank you.